Welcome to the video, everyone. In this video, I will talk with Dr. Jeffrey Ruterbusch about HGH, human growth hormone, and that for anti-aging and health. So we will be talking about the dose, time of day to inject, sub-Q versus intramuscular, and so on.
This is the TRT and Hormone Optimization YouTube channel. And if you want to learn all about the science-based information on this topic, consider subscribing, hit that notification bell, and you'll be on your way.
So welcome back, Jeffrey.
Well, thanks for having me back, Steve. It was nice to be back.
Thank you. So let's talk first about maybe the benefits of using human growth hormone.
Yeah, this is a large topic, and I'm going to try to bring it in and all these loose ends. Let me just back up a little bit. I know we're on a time slot, but I was first exposed to growth hormone as a sports med doc. And back, 25, 30 years ago, I was using it at about 0.2 milligram injections into like knee joints and shoulder joints to regenerate cartilage, regenerate joint tissue. And so I was amazed at, how well it worked. So that was my first exposure as a sports med doc. And then, going through the gyms and speaking to people, I would see these tremendous, almost overnight transformations in people. I'd be working out and I would see a personal trainer working with an older gentleman. And it seemed like almost overnight, this person's physique was transitioned to, almost overnight to a person half their age. And I'm thinking, how are they doing that? And I come to find out, the personal trainers here were giving the patients or their clients, not only testosterone, but they were giving them growth hormone. And what I would see, especially for repartitioning body fat and burning visceral adipose tissue, it was just tremendous. So I would see so many anecdotal, patients who would walk around, and I'm thinking, that stuff must really, really work. But as you know, in the States, maybe not, you don't know this, but we as doctors are not supposed to write for growth hormone unless the patient has a bona fide, adult growth hormone deficiency. And that's usually a pretty expensive test that endocrinologists do. And then and only then can we write for growth hormone. It's strange, it's not a controlled substance like testosterone or opiates or benzos, but yet we can't write it off label for what we think that the patient could benefit from. So that's very unique. Okay, so we'll back up now to get on track. I mentioned that briefly. I saw a lot of people that it would burn body fat very, very well, especially in older men, 50s, 60s, that had the bit of belly fat and then the love handles here around the hip bones and so forth. But what I really found in my travels is how quickly it improves sleep, mood, and energy. All right. And it did that so magnificently that in my research over the years, they kind of equate it to the Lazarus effect, where almost wakes people from the dead. They just turn into completely different individuals with so much more livelihood, like the fountain of youth in that regard. So those are the things I find would be most instantaneously impacted in sleep, mood, and energy. Now, I, as a former bodybuilder, pro athlete, I have used growth hormone, but I only used it for a few months and I didn't see much effect. Now, hindsight being 20/20, in my research after I got off it, you have to get on it for 3 to 11 months on average to start seeing the benefits in body shape, as far as repartition. These are anti-aging doses, which are physiological, versus the super physiological doses. I would see many of these men change almost instantaneously on much, much larger doses. So I've seen it from both the athletic side, the sports med side, and now, of course, I'm into it for the anti-aging therapy. Given that regulation that we can't routinely prescribe it, I've had difficulties trying to justify it, in a soap note or something, in case the federal agents were to come in and say, justify you providing this patient with growth hormone. So it's very difficult, and it's a hot spot. And I hope to, after this talk, open up some minds and really just tell people, listen, I'm going to start using it again. Not using it as a patient so much, but as a prescriber, because I know how to do it safely. Back in the 1990-ish, Dr. Rudman did a really big study that hit the journals, and it really launched the research into growth hormone significantly. But he was giving 18 to 24 units daily. And so over time, over 6 months time on average, people were getting some negative consequences. In particular, joint swelling, joint pain, arthralgias, and some insulin resistance. That's what he, but then again, he didn't know back then that was way too big of a dose.
Before we continue, if you appreciate the content we bring to this channel, check out the Amazon links in the description of this video. These are the links to the products we use, going from supplements, protein powder, pre, post, intra-workout, anti-aging cream, sunscreen, needles and syringes to inject, and so on. If you'd like to purchase one of those products, please use the direct link so that it will earn us a few cents as a tip, and you'll be guided directly to the products we recommend. Thanks in advance.
All links should work on the US, Canadian, and UK Amazon stores.
So the usual dose from an anti-aging perspective that I put people on is 0.4 milligrams daily for men, and 0.6 milligrams daily for women. Women require a little more to get their numbers optimized. It's the way it is in physiology, I suppose. So again, and I will actually start them smaller, like 0.2 milligrams daily. But I just find that if I go right to 0.4 for men and 0.4 mgs for women, I'm able to get the IGF-1 values to an optimal level quicker. So I don't, even though the textbooks say start slow and go slow, I just jump right to 0.4 for men and 0.6 for women. I find I can dial them in quicker and get the IGF-1 levels enhanced and optimized. And so what's a good level? Well, I like seeing men above 250 for IGF-1. So 250 to 290, women just a touch lower, 220 to 260. But that's the controversial issue. What is the cutoff for what is normal? Dr. Rudman back in the 90s thought that anybody below 350 was growth hormone deficient. He would tag them with the adult growth hormone deficiency diagnosis or somatopause, and you would treat them. In my studies through the age management medicine group, they're a little more conservative. They don't like you above 250 in general. I think it's best. Now, having said that, that's the number we look for in IGF-1. But you have to measure IGF-BP3 simultaneously, because if IGF-1 comes up, IGF-BP3 has to come with it to protect. IGF-1 has mitogenic properties, cell turnover, cell growth. So people fear cancer, But IGF-BP, when it comes up with it, has apoptotic effect. So it's protected. So if you have somebody on, physiological doses of growth hormone, you measure the IGF-1 and IGF-BP3. Because if IGF-BP3 doesn't come up with it, and there's a big gap, then you have more increased risk of a bad outcome. So if you monitor those two values, and you want to check, blood sugar with it too. I like checking what's that? I dumped it. Hemoglobin A1C. I like following that one too. Make sure that the sugars are controlled. But in my experience, if a man, is serious about growth hormone, he's serious about his health. So he's going to be in the gym, and he's going to be working out, and he's going to be eating well. So he'll take control of his glycemic numbers. And he'll take control of those metabolic factor measurements we look at for metabolic syndrome. And so the best outcomes I have found with growth hormone is is in simultaneously with testosterone. Because believe it or not, guys, the best way to increase your growth hormone naturally is with testosterone. It's the best substance to increase IGF-1 naturally. It will come up when you're on testosterone. So again, the men who are serious, the bodybuilders or the anti-aging guys that really are serious about doing it correctly, they will do everything the right way. They're very conscientious. So it's really not worth it to me to put a man on growth hormone if he's not going to change his lifestyle and watch his blood sugars and so forth. And so that's my experience. If done correctly, and like I say, I've researched this. There's been over 20,000 studies in the literature that tout the benefits of growth hormone supplementation. Over 20,000 studies that support it if done correctly. And basically, if done correctly, like I said, and the numbers are watched, and the person doesn't hack their way through life by living poor lifestyle choices, probably the safest hormone out there, to be honest with you. I mean, it's been around for such a long time. Now, you mentioned, I think, going into growth hormone doses. Let me tweak that a little more. Older people require less. Obese people require more, okay, to get the results and to get those IGF-1 numbers where I want them. So remember, older people require less, I'm talking real old, and obese people require a lot. Matter of fact, I've had some obese people that are almost growth hormone resistant. I can't seem to really budge their numbers if they're really too much overweight. But that's rare. But I just found, as I said, you have to go heavier doses in the obese and go slower and lower with the older individuals. And oh, by the way, the bad outcomes I mentioned earlier, it's been found to be more involved with not the dose of growth hormone, but the rate of change of incrementally increasing it. So if you go low, start low and go slow, if you bring that increased growth hormone levels up slowly, the chances of the bad outcomes like the arthralgias and the edema are greatly minimized.
Okay. I know you like metformin regardless of growth hormone, but do you recommend people on growth hormone always going on metformin, maybe because of this resistance?
Yes, as I mentioned, if I dial it in correctly and go slowly with it, I don't have the problems with physiological doses with insulin resistance. But since we all know that metformin is a great anti-aging medication, yes, I recommend it for all my patients, whether they're on growth hormone or not.
I've seen on the forums that there are discussions whether it should be injected before going to bed Others say no, inject it in the morning, so you have 2 peaks, one at night and one during the day.
Yeah.
So what's your general recommendation?
Older textbooks, older lecturers, older notes say always do it at nighttime to mimic the growth hormone pulse. But now the pendulum is shifting a bit to taking 2/3 of the dose and doing it at night and doing 1/3 of the dose in the morning.
Okay.
And again, that would be dialed in on based on how you feel, how you're looking, and the numbers being followed by your doctor.
Sure. And that's always injected subcutaneously?
The textbooks always say sub-Q, but I've talked to people in the gym, this is anecdotally, of course, that get the same benefits whether they go sub-Q or shallow IM.
Mm-hmm. Okay.
But I always recommend sub-Q because that's what my notes and my textbooks and my experience has been.
Hey, and now do this next. Click on one of these thumbnails to learn a ton more about TRT and hormone optimization.